So today I decided to speak to you from my office instead of the atrium and Government Plaza. So I want to welcome you into my office today. It's been a busy day like so many others, with our primary concern being about protecting you. You know, I would be remiss if I didn't just remind you, like we do so often every day, to be washing your hands, keep the social distancing, and stay at home. I think there are many who are beginning to believe that, that not necessarily that you feel bulletproof, but that you may not get this virus. Please don't let your guard down right now. Now is not the time. This is the peak that we expect to see, and so it's not a good time to quit doing the things that you've so diligently been doing over the last few weeks. So thank you for your cooperation in doing that. I think that later this week we'll know whether the projections or the modeling that predicted that we would have a peak, whether that's going to come to fruition. Based on my conversations with the hospitals, they are not seeing a run-up in cases. We're still in great shape. If there was to be a surge that would come, I'm 100% sure that over the next couple of days, based on what we can predict, that we have plenty of ventilators and plenty of beds for the city of Mobile. So that's something that we can all be grateful for, because the hospitals have gone to great lengths to make sure that there are beds available during this period of time. You may be wondering what it is I have in my hand here. So these are the components of a test kit, what we call the antibody test kit. And for the last few weeks, the city of Mobile has been diligently trying to procure these. Actually, we agreed to take 6,000, which were donated to us from Synergy Labs. Well, we've also ordered, and by hopefully tomorrow, we'll receive an additional 6,000. Plus, we have another 600 that we've agreed to take for a certain number of days to make sure that we have sufficient tests. I've spoken to you about what we've done with our first responders, those 900 tests. Over the next few days, we'll be testing about 200 to 250 of our public service workers. So then when we start thinking about what is the priority for the tests that we have available to us, it really comes down to protecting our healthcare providers. And that would be all of our hospitals who are on the front lines. That's the men and women who are manning the testing centers, the drive-thrus, and also the clinics like the Franklin Clinic. So we have offered several hundred to each organization to deliver to them in the next couple of days to be used on their nurses, their doctors, anybody that they think that needs to be tested to see if they have an active antibody, in their system fighting the coronavirus. Anyway, it's just another tool in the toolkit, but it's a part of our commitment to try to make sure that you, the citizen, are going to be safe. And part of that is making sure that our hospitals are fully manned. And again, this is a tool that they can use just as we did to make sure that we have adequate policemen and adequate firemen on the street to service you when you have that need. So I would also, changing the subject just for a moment, is just to remind you that there are still a lot of good news stories out there that we would appreciate that you letting us know about them. One other comment that I would make prior to closing is that regarding the big box business, we've heard from a lot of you. We've heard pros and cons of it. We've also been in contact with the big boxes. We've heard from them. And the bottom line is this: if the big boxes will do what they should be doing to regulate the number of people going in and out of the store, and if you as an individual would keep the social distancing, there really won't be much else to do. So my hope is that they will do what they're supposed to do, that you will do what you're supposed to do, and we'll move on down the road regarding that issue. Since this is being broadcast live from my office, I'll just flip to George just for a second to see if he's had any questions come in that I may answer at this time. Does anybody have any questions? Well, look, tomorrow we will be making a presentation to some of the hospitals regarding these little test kits, and I hope that they serve the purpose of keeping you safe. Take care of yourself. God bless you.